You're wired in. SmallCapVoice.com. Following is a presentation of SmallCapVoice.com, today's leader in investor relations, capital formation, and retail support. Now, with your online business briefing, SmallCapVoice.com's Stuart T. Smith.
Welcome one, welcome all to this online business briefing brought to you by SmallCapVoice.com. And as you just heard, I'm your host, Stuart Smith, and we're joined today for the very first time by PositiveID Corporation. PositiveID is traded on the over-the-counter bulletin board exchange under the ticker symbol PSID. We're joined today by the Chief Executive Officer and Chairman of the company, Bill Carrigal. Bill, how are you today?
I'm very well, Stuart. Thank you.
Thank you so much for taking time out of your schedule to speak to your company's existing shareholders as well as our listeners here at SmallCapVoice.com. And for those listeners who may not be familiar with your company, if you would, describe the business model and market for us.
Sure, Stuart. Our business model is really focused on two areas. Our company, just to take a little step back, was founded 2 years ago, and our initial focus was on medical devices, specifically focused on the diabetes management and specifically blood glucose detection. And then in May of last year, we acquired a molecular diagnostic company by the name of Microfluidic Systems, which has a tight correlation in some of our development on the medical device side, but importantly is a platform of close to 30 patents and patent pendings focused on bioagent detection, which was all done under Department of Homeland Security contract over the course of the past 8 years. So our two business focuses is in diabetes management on the medical device side and on Homeland Defense on the molecular diagnostic and biodetection side.
Let's talk a little bit about those target markets then. You've got two different markets that you're going to be attacking here. Obviously, the diabetes market's going to be one size. The Homeland Defense market's going to be another. I'm sure most of our listeners are familiar with the size of the diabetes market, maybe not so much with Homeland Defense. So if you would, talk about the markets that you're going after.
Since, as you said, the diabetes market is pretty well defined, I think what I would just highlight on that side of our business is that we have three products under development. The first, a wireless device that was approved, or I should say cleared by the FDA in November of 2011, so just a couple months ago. That wireless device, the product that we call iGlucose, will automatically transmit blood glucose readings when coupled with any data-capable glucometer to eliminate the logbook and the very manual process that's been in existence for so long of tracking blood glucose readings, moving them into the cloud, again through text messaging in an automatic manner that then enable them to both be managed and then disseminated either through text messaging, through email, to caregivers, to the medical community, to loved ones, which is very relevant when you think about managing or helping manage the diabetic care for a type 1 child or perhaps an aging parent who's suffering from type 2 diabetes. The other two products are equally, and some might say even more exciting, because each of them, in a different manner, focuses on the ability to measure blood glucose levels without using the current invasive process of pricking one's fingers 2, 3, 5, 6 times a day in order to take blood to test blood glucose levels. The first product that we call the GlucoChip is under development with our partner out in Minneapolis called Receptors. It's based on our fundamental intellectual property upon which this company was founded, which is an approved patent for an embedded biosensor. It's about the size of a grain of rice. It's predicated on the FDA-cleared VeriChip, which was a product that was cleared back in 2004, but importantly includes the interface with a biosensor, which is importantly what we've been developing with our partner in Minneapolis called Receptors. We're currently in an initial clinical study around the biocompatibility of that of the membrane that surrounds that chip, as well as having proven on the bench that the biosensor works in blood plasma. So we're very excited about the status of that development. And then finally is our EasyCheck product, which is a breath analysis device which measures exhaled acetone in a diabetic's breath and its correlation to blood glucose levels. We're developing that product with our team of scientists and engineers over in Israel, and we have done preliminary testing in the lab to demonstrate a strong level of correlation between acetone and blood glucose levels. And importantly, in our most recent announcement, have announced that we're going to be launching our first clinical study with Schneider's Children's Hospital in Israel with a world-renowned and preeminent endocrinologist by the name of Professor Moshe Philip. And we were very excited to make that announcement, and we're even more excited to get into the hospital and begin testing this device in a side-by-side test with type 1 diabetics using our EasyCheck device to measure blood glucose levels, and side-by-side comparing that to what a test of a typical blood glucometer shows through a typical finger prick testing. So we're very excited about our diabetes management platform. And the second piece of our business, in the area of homeland security, is important. It's important to take a look back at how our M-band microfluidic bioagent network detection system was created or invented. Over the course of approximately 8 years, there was a little over $40 million of development done under Homeland Security contract with, of course, the Department of Homeland Security to create what is targeted to be the next generation of biodetection devices. There is currently around the country a program called BioWatch, in which air samples are taken to monitor for approximately 6 bioagents that could be components of weapons of mass destruction. This was a program instituted after the anthrax scare back in 2001. So this program has been put in place and provides for a warning system that will typically run between 36 to 48 hours from the point of detection. Importantly, the next generation, or what they call the Generation 3 BioWatch system, is fully automated. It's a lab in a box. We have a picture of it on our website for anybody who wants to take a look at it. But it essentially will take an air sample, break it down and test it at the DNA level for the screening it, of course, for the bioagents that we're looking to detect, and if found, provide an automatic and immediate alert back to a command and control center. That process can be done in 6 hours versus the 36 to 48 hours of the manual process, taking samples back to the lab and processing them. That's critically important in an effective defense system that provides an early warning in such a way that it can be addressed and the casualties can be massively reduced. That market is best defined by the draft request for proposal that the Department of Homeland Security put out at the end of 2011, which estimated the 5-year program to be at $3.1 billion. In looking at the current analysis of the market competitors, we and one other company using a technology out of Lawrence Livermore National Labs should be the only 2 biodetection systems that qualify for this opportunity. So importantly, each of those 2 technologies will be positioned on teams that look to approach this opportunity as it unfolds over the course of this year.
Well, listeners, once again, we are speaking with PositiveID's Chairman and CEO, Bill Carregal. Bill, you are the Chairman and CEO, as I just mentioned. You are our guest today, so let's learn about your background.
Sure. Thanks, Stuart. If you look at my background, I've got in some ways a typical, in some ways a unique background when it comes to technology companies and the development of interesting technologies to capitalize on market opportunities. For the first roughly 17 years of my career, I was up in Washington, D.C., before I relocated to Delray Beach about 6 years ago. My career started with one of the large, now Big Four accounting firms, Deloitte & Touche, both on the consulting and the audit side. And then I've really spent the better part of the last 20 years working with growth stage and early stage technology companies, discovering and uncovering technologies and pieces of intellectual property, and then commercializing them. That's come in my history both in the form of taking companies and building teams around particular pieces of technology and bringing them to commercial markets, and has also been with discrete, unique opportunities, finding the right partners, market partners, to do the type of licensing deals that help give strong partners and match them with strong pieces of intellectual property. For the past dozen years, I've really been focused in two areas, as you well know, and as the time we spent talking about our diabetes management products, I've been focused in the healthcare market, and specifically the device market for the better part of the past 8 years. But as you might imagine, having spent the amount of time that I did in Washington, D.C., I've spent a lot of time in the physical security markets, most of that work having been prior to there being a Department of Homeland Security, back in the days when the department was actually about a dozen different units, and importantly worked on one of the early stage companies that developed millimeter wave technology that's currently being utilized in airports today in those full-body scanners that are being used effectively but are also somewhat controversial in airports today. So I bring to everything I do a real love and focus of a couple markets, and as a result, people who know me well and who've been working with me for the past 20 to 25 years are never surprised that we have such a heavy focus in both the medical device field as well as in the Homeland Security market.
Well, listeners, as you heard Bill point out earlier, this company has had just a tremendous amount of work done in the past couple of years. Young company, couple of years old, lots of acquisitions, lots of things to look at on that press wire. Please go back and review 2011. Again, a big year for the company. But right now we want to focus on the future. Bill, while we have you, let's get your personal goals for the company here in 2012.
Well, Stuart, my goals really come back to the product lines and developments that we talked about, and I think in the time that we have, I would focus on two of those to really highlight, not to take attention away from the importance of everything that's going to come through from commercialization of iGlucose following the FDA clearance. But when you think about the clinical study we're about to launch with EasyCheck, and being able to have a large amount of data on the side-by-side testing of type 1 diabetics, the exhaled acetone test from our EasyCheck device compared to the finger prick method, I think that's going to fundamentally demonstrate the value of the technology that we've developed, for which we have patent pending, and will lead to a lot of important partnering and business development opportunities that really allow us to give full light and sunshine to that important development. And the second one goes back to the other side of the business, Homeland Defense, and the important BioWatch procurement process, which has begun but hasn't yet launched. The planning process is underway, as demonstrated by the release of the draft request for proposal at the end of 2011. And we are working diligently within our labs, as well as with some significant partner potential, to line up the right team to be able to capitalize on that very large opportunity during 2012.
Well, listeners, if you'd like to learn more about this company, and I encourage you to do so, please visit them at PositiveIDcorp.com. Well, we were talking earlier about the EasyCheck breath glucose detection device, and Bill, out on the wire here today, February 7th, you guys issued an update. Let's talk a little bit about that update.
Yes, I alluded to that a little bit earlier, but to dive down a little bit deeper, what we announced on the 7th is the commencement of our first clinical study related to the EasyCheck device. We'll be working with Professor Moshe Philip out of Schneider's Children's Hospital outside of Tel Aviv, and we are very pleased to be working with such a world-renowned endocrinologist to help us with this independent testing and evaluation of our product. The testing should commence over the course of the next 30 days, and we expect to see significant results after a 6-month period of time. So this is a very important step in our development of what could be a truly life-changing type of a product for diabetics, and we're very excited to be working with Professor Phillip, as well as gathering the results over the course of the next several months.
Well, I want to thank you one more time for coming here at SmallCapVoice.com. So much to go over with your company. What an exciting young company, listeners. Please dig into that website. We're going to have Bill back very soon, and we're going to break down this business model even further. We're going to jump into some of the individual businesses as well and product offerings. So please check back for updates to this audio interview. Bill, thanks again for your time here today.
Stuart, thank you very much. It was a pleasure.
All right, for Bill Carrigal, this is Stuart Smith saying thanks so much for listening.